Rocky 99, the Conemaugh Health System, and Somerset Hospital, along with the Cambria County Drug Coalition, we've teamed up to fight drug addiction with our Hearts Against Heroin awareness campaign here in the Laurel Highlands. And today we welcome Dr. Jeanne Spencer in. Thank you for coming, Doctor.
Thanks for having me.
Now, you started with you were actually one of the first people with the Drug Coalition. You got things going.
Right. So I think multiple community leaders saw that there was a problem in our community, and we decided to try to do something to work together and pull together to try to attack this problem. I think really law enforcement took the lead, the district attorney, and then the healthcare came along, and treatment facilities as well. So it's a combined effort.
Let's go with overprescribing of pain medication. You, as a doctor, do you say absolutely they're overprescribing?
I think that there's definitely been a problem with opiates being too available in the community. For a while, there was a huge push to control pain without people being very aware of the risks of too much opiates. And so I think that the pendulum is swinging the other way now.
The biggest misconception of what an addict is, from your standpoint?
I think the biggest misconception of a person who's battling addiction is that they would not be like me, that these people are, poorer than I am or from a different race, and that's just not true. We're seeing people who are from all economic statures and also multiple ages, so it's not just kids. We're seeing middle-aged people as well.
It's all walks of life. It doesn't discriminate.
Right. You can't tell by somebody's job or by somebody's neighborhood whether they'd be battling addiction.
We've heard about the naloxone, Narcan. What does that do physically in the body? Like, how does that work?
Basically, Narcan turns off the opiates. So if you've taken too much and you're passed out, the Narcan will reverse that and wake you up. Of course, you need to call 911 as well because it may wear off, and you want to be where you're safe, where people can help you.
Is it almost like an instant thing that somebody wakes up?
It is an instant thing, and that it does cause them to wake up.
Wow.
One other thing that the public should be aware of is that there's a standing prescription for Narcan, so any person can go to any pharmacy and get Narcan. They may need to order it, but most have it now. Your insurance, if you have medical assistance, will cover it. Otherwise, you may need to find out what your costs will be under your insurance.
But you can actually get it at the pharmacy then?
You can just go to the pharmacy. So if you know somebody who's using heroin, I think it makes good sense to have it in the household.
Since you're a medical professional, do you think that as far as addiction goes, are we talking genetics?
I think that addiction has a genetic component, so if people in your family have problems with addiction, you're at higher risk, but it's also environmental. So if you're in bad circumstances or with friends who are using opiates, you're much more likely to use it as well.
I go to a wedding reception, have 3 beers the other day, and it doesn't make me want to go, okay, I need something bigger.
Right. I think certain people, using the alcohol example, certain people can drink 3 beers. Other people need to drink until they're drunk. I think one of the risks of medications, starting medications for pain, can be that you may be a person who's very likely to become addicted, and even just using pain medication for surgery can be risky.
Now, something that interests me medically, what does heroin actually do to the body?
So heroin acts on the opiate receptors in the brain and can cause the high or the euphoria. It also, decreases pain. But as you use it more, I think addicts switch, and no longer are they getting that high. What they're getting is really trying to avoid withdrawal and getting sick, and that becomes, very unpleasant.
You had a key role in developing a TV commercial about heroin, and you worked with the development team and a video, Tell Me Why Heroin, a community response. People can see this video and get it on the hospital. Where can we find that?
Right. So we developed a 30-minute video that is really quite touching about people who have had problems with addiction and ways to avoid it. It can be obtained free on the Conemaugh.org website.
I'm reading about medicated assisted treatment. Tell me about that.
I think there are 2 main ways that people with addiction get treatment. So one would be an abstinence-based, or they just, go off the medication altogether. The second is medication-assisted treatment. So this is usually methadone or Suboxone. The studies have shown that the percentage of people that can get away from heroin is much higher if they use medication-assisted treatment.
And finally, what do you think is the biggest hurdle facing this whole battle?
I think there are multiple hurdles, but I think we have a number of people who've been using prescription pain medication, and as physicians are prescribing less of that, they're finding that they can't get their usual medication, and they're turning to the streets. I think it's sad that it's readily available. I think that obviously we have an economically depressed area here, and so people without jobs and often without hope are more likely to turn to these substances.
Thanks so much for your time and your efforts, Dr. Spencer. Hearts Against Heroin, presented by Conemaugh Health System and Somerset Hospital. With Spangler Subaru, Martin Baker America, Yeager's Heating Service, First Summit Bank, and your friends at Rocky 99.